All right, there we go. All right, took me a while to figure out what I wanted to do. Hello, this is chapter 12. I wanted to go ahead and do chapter 12, 11, 12, and 13. Provide those to you. 13 will be a really short presentation. So, let's get started. Chapter 12 is about public policy, which is how do we make decisions about what kind of programs are we going to value, what kind of how are we going to go about meeting the needs and desires and values of our citizens as a government, as a state. And it's going to fall into, as we mentioned in the previous lecture, chapter 11, Texas does not spend a lot of money, and therefore that puts some constraints on the number and types of programs that they can support and fund. So we want to make sure that we have an ample opportunity to kind of see how the process works in terms of creating public policies and funding initiatives and things like that. Okay. All right, let's get started on that. Oops. Tap here. Okay. All right, having some technical difficulties. Give me 1 second. Okay. Okay. All right, let me go find where we are here and go from there. How about that? All right, here we are. I'm sorry. All right, so chapter 12, public policy. Okay, moving on. All right. All right. A lot of public policy in Texas centers around things like education, things like how do we take care of the poor, how do we manage natural resources. These are all big, important public policy agendas that the Texas looks at. And because they do limit what they do in terms of taxing and spending, this puts some constraints on the number and types of programs that they can fund and can focus on. So public policy issues and problems in Texas include tax reform, education, criminal incarceration, and of course, a conservative agenda dominates the policy debate across the state. That basically is going to be, like I said before, more libertarian, lower taxes, lower spending, fewer rules as opposed to more rules, less federal interaction as opposed to more, things like that. Public policy refers to the outputs of government institutions. So what are they doing? What does that look like after the process through, and how does that process go about? It's expressed goals of government backed by incentives or sanctions. So what kind of stick and carrot does the government use to get its policy making ends accomplished? Okay, usually legislative bodies, rules, regulations, orders from public agencies. And a lot of times it's complicated and messy process that has multiple stages. So the first step is problem identification. What is the problem? What do we want to fix? What's the issue? The example here is given, we have poverty in Texas. So how are we going to fix that? How are we going to go about that? And then those problems have to fall within the authority of government, which in and of itself could be controversial in discussion and deciding whether or not something is within the government's purview or within their authority. So some people would argue, well, that's not a government issue, that's not within their scope. So why are we doing that? The second, formulation. So coming up with ideas in order to try to figure out ways to approach a problem and ways to perhaps conceive of and identify solutions. Okay, this is often called agenda setting, and it involves the prioritization of parts of a problem in order to try to solve it. Implementation, which is, okay, we come up with what we think is a solution, we're going to put it into place. Who's in charge of that? Who implements it? How's it gonna be funded? You know, what are our outcomes? And then finally, evaluation. Now that we've done all of this, how do we know it's been effective? How can we amend it to make it more effective? Or do we want to continue on this particular plan or process at all? Okay, rationality and policy making. Clearly identified goals that aim and the aim of achieving them at an optimal or efficient manner. Efficiency means maximizing the outputs of government with a minimum of resources. So we want to decide if there is a rational way to solve the problem. If solving a problem requires way more resources than it is desired, or that there is will to provide, then a policy may not happen. For example, if we decide that the best way to solve homelessness is to build everybody houses, and the state's going to foot the bill for that, that's probably not going to be a policy objective that will get off the ground, because it simply exceeds the resources available. Okay? Factors that work against rationality: government tends to work incrementally, meaning they work a little bit at a time, step by step. Rarely do they take large steps. Okay. Also, policymakers' rationality may be a bounded rationality. So there's limits to how far particular policymakers will go, and then they tend to say, okay, what needs to be done as opposed to what can be done, or is there a short-term fix? Is there a short-term way to solve the problem as opposed to necessarily a long-term one? Big business education. Texas ranks 44th in public expenditures per enrolled student. So we spend, only 6 other states spend less per student than Texas. Okay, the Gilmer-Aikens Act, 1944, establishes a framework for education policy in Texas. Part of that policy was forced upon them, which was desegregation. And we want to differentiate between 2 types of segregation. One is de jure, which is by law. The law requires segregation. So this was the case in the South during the Jim Crow era. So from the late 1880s, 1890s, all the way up through probably the mid-1960s or 1970s in some cases, right? That's de jure. De facto mean the law does not support it, the law does not enforce it, the law, you may even forbid it, but it may happen anyway because of social pressures, social ideals, the natural ebb and flow of society. For example, a lot of urban resegregation has occurred in the last 30 years because of population movement, because as people become more affluent, they move out of certain neighborhoods, leaving only those people who are more disadvantaged in those neighborhoods, which creates a de facto segregation. Nobody had to move. Nobody forced the poor people to live there, but that's just the way it ended up. The people in poverty could not move. The people that were not in poverty could, and therefore that caused a de facto segregation. Sometimes segregation is reinforced by structural realities within a system. Sometimes it is just a natural occurring movement and changes in society. So equal opportunity in schools, becomes an issue after Brown versus Board of Education in 1954, but there is a lag in that, and not all schools are desegregated until the late 1970s. Kirby versus Edgewood is another case that's important on public school fulfill constitutional provisions. So basically, our education system is funded through property taxes, which is all fine and good if you live in a wealthy neighborhood or a wealthy part of the state or a wealthy city that has high property values. If you live in a place that has low property values, there's no overcome the momentum of the property values. You are going to be kind of boxed into a low-income situation as long as the property value remains low. And what ends up happening is a lot of times this is a cyclical problem, and that good schools raise property values, and high property values fund good schools, so on and so forth. So if you find yourself on the back end of this cycle where low-income school or low property value funds low quality schools, so on and so forth, it becomes a very difficult cycle to break out of. So in 1989, this is important. This was almost 30 years ago. The Supreme Court upheld that the funding system was in violation of the state's constitution, touching up a firestorm, touching up a lot of controversy. Again, how do we do this? How do we create a fair funding system? Okay, one of the systems that was brought up, and it lasted for about 15 years or so, almost 20 years probably, was called the Robin Hood Plan. And basically what it does is it transferred some tax revenue from wealthier districts to poorer districts. So there was the state would recapture some of those property tax funds, and then they would shift them to lower income schools. And they could use those funds to address instruction and hiring better teachers and things like that. So this lasted until probably about 5 years ago, and then there was kind of a falling out. The wealthy school districts took the state to court and basically said, this system isn't fair. This system is no better than what Edgewood versus Kirby was fighting against. The state agreed, and that they said that there would need to be a better way to solve this problem. The Robin Hood is not going to be the solution. They have yet to do that. Okay. Texas accountability systems. Also, these are once again education policy about how do we create the best possible educational environment. Recently, some of the issues that have come up in this educational accountability conversation is how do we make sure that our schools are performing where they need to perform? And as an educator, and you guys have heard me talk about this all semester, I have very strong opinions about this. And I'm not going to get into too much of those, but I am not a big fan of very many of these at all as a way to assess that. But some new movement along the accountability lines is one, of course, accountability through testing, using standardized testing to do that, although that is beginning to become less popular, even though we still have the STAR system in place, even though we still have some federal mandates in terms of testing. School choice has been offered as an option, so things like voucher systems, which would allow students to move from school to school within a district, and sometimes between districts, and sometimes between public and private schools. Other school accountability standards and things like that. Teacher salaries and state spending remain low, as do scores among minority students. Possibly be a correlation there. Working with struggling learners that have more needs is a more difficult task that requires more training, and it requires more skills. It requires more motivation to do it. It's hard work, and therefore maybe there's a correlation between the state salaries and the outcomes of low-income students. So voucher systems in charter schools and alternatives to the traditional K-12 educational structure. Charter schools are public schools, but they're independent and they get less funding. They get about 80% of what a normal school would get funding-wise, but they have some more flexibility in some of their structures and some more flexibility in their ability to function. They're independent of a lot of the district-level bureaucracy that tends to come with a more traditional school structure. Excuse me. And then some say, let's just spend a lot more money to get the best teachers. One long-term challenge in the state has been, how do we provide for the poor? We are a border state. We have a large number of immigrants who come here and they do hard work and they provide a lot for our state. But they also, for part of their time here, are often struggling financially. They are often poor. There are entire areas of the state which suffer from extreme poverty, whether it be the Valley, whether it be far West Texas, and rural parts of the state. You're going to see higher levels of poverty there as well. So one of the state's priorities has been to try to deal with these issues. But at the same time, they want to do so maintaining their kind of libertarian values. About 17% of Texans live below the poverty line. Poverty is defined as the condition under which individuals or families do not have the means to meet their basic needs of food, shelter, healthcare, transportation, and clothing. Okay, basically, those are the things needed to be able to live an independent life. Can you eat? Can you have a place to sleep that's safe? Can you get to and from where you need to go, be it school or work? Do you have the proper clothing in the proper season? And if you get sick, are you able to become healthy again in order to continue your life? If you can't meet these basic needs, you are to be living in some level of poverty. That's 17%, or over 4 million people. So there are a couple of very important things that happen in the history of poverty or fighting poverty in the United States, but especially in Texas. So one of the biggest anti-poverty campaigns begins in 1935 as part of FDR's New Deal, and it's called the Social Security Act. Okay, and the idea of the Social Security Act is to help provide the elderly, help provide for people when they get older, when they can no longer work, and provide them a safety net so that they can have a minimum amount of income in order to stay out of poverty and have their needs met as they get older. And we also have the Aid to Family Dependent Children program that is designed to provide for things basic food, shelter, quality shelter, kind of subsidies for families in order for those to be met. States, however, are often given the responsibility of maintaining these programs. 1960s, federal courts ended a series of policies that had limited welfare roles. Congress established a program called Medicaid. Johnson's War on Poverty expands the social services. Texas Department of Welfare was authorized to work with the federal government to poverty programs. So as programs expand, this puts more pressure on states to figure out how they're going to meet those. Okay, SSI, number of children on AFDC during this time between 67 and 73 rate rose almost quadrupled. Okay. One of the problems was that as welfare rolls rose, so did the expenditure, so did the cost. That taking care of poor people, and that's not a pejorative term, it's just a fact, right? The less people have to provide for themselves, the more the state has to provide for them, the higher that cost is going to be. That's a simple math. Then there became some kind of pushback, especially in conservative circles, that welfare programs and programs that were designed to help the poor were creating dependency. This idea that people would get into a cycle of using these programs for their sole sustenance and would would not move forward, not move out of poverty, not establish more secure and independent economic means. In 1993, the Texas Comptroller found that 1/4 of welfare recipients were long-term, meaning that they were not moving off of welfare, not moving off these poverty prevention programs, but were using these programs or were dependent upon these programs for longer than was intended and was longer than what was thought to be sustainable by the governments that were funding them. Welfare to work. Initiatives, temporary assistance for needy families, begins to put some limitations on the times in which the time people can be on these programs over time. All of this is important because at the end of the day, the state is paying for these things. So the state is mandated by the federal government to provide budgets and outlays for these programs. Federal welfare reforms in Texas have been evaluated along two dimensions: the number of people receiving welfare and the degree to which reforms take people off. So if the number of people is getting higher, the number of people that are coming off the rolls is not high, then there's questions about the efficacy of the program. So the idea is that if it's an effective program, the number should be relatively small, or at least should not grow very rapidly, and the number of people that are able to cycle off or move off of the program should be relatively high. Reforms are seen as a success in terms of keeping the numbers low, but they are often seen as not necessarily as successful in terms of keeping of people leaving. So the implication of this slide is that a greater number of people are becoming long-term welfare recipients. I see a lot of data that actually disagrees with that statement. That may be at the federal level. In Texas, that may be the case. I think at the federal level, I've seen some very different data. All right, I have a washing machine on my porch right now. Okay. Health insurance is a major issue. Obviously, if you are poor, you do not have access, or have less access, or less flexible access. Most health insurance in the United States is provided by people's employer. So if you are marginally employed, if you are unemployed, or if you just simply work part-time, anyway, you are kind of at the mercy of your employer as to whether or not you have it. So the government has some programs available, such as Medicaid, that is available to people that are in extreme poverty. Federal law allows states to be granted waivers to create programs for particular clients. So Medicaid is seen as a minimum requirement, but if a state has another program or another way to use those funds that will serve the same or better purpose, they are often allowed to do that. Okay. Children's Health Insurance Program, or CHIP, is kind of an in-between program for families that don't qualify for Medicaid, but still do not have adequate medical care for children, medical insurance for children. Skip that. Skip that. All right, the Affordable Care Act, also known as Obamacare, I call it the Affordable Care Act, was passed. It requires individuals to obtain insurance or pay a penalty, and it expands Medicaid. So it's insurance by expanding the government plan and by providing incentives and subsidies for people to join private insurance plans. Most of the states challenged the ACA on the basis of the Medicaid expansion, that it puts an undue financial burden on states, and so there have been multiple states that have challenged that. Texas has challenged it like something like 25 times in some different way. And in 2012, the Supreme Court upheld that there could be a tax placed on people who refuse to buy insurance. Once again, the idea being that this large plan only works if everybody participates. If you can opt out, then it undermines the availability to others. And so this is where what's called the individual mandate problem comes in. And the court found that the individual mandate, or the tax on people that refuse to get health care, was constitutional. But states could not be forced to expand Medicaid. So they could not be forced to increase their own state spending in order to expand the federal programs. It's still unclear. It's still early on. I mean, this law is only 5 years old, really. And it's only really been fully implemented probably in the last 2 years. And so it's hard to know what the implications will be. Doctors accepting new patients who rely on Medicaid has been dropped. So fewer doctors are participating in Medicaid. And there's still a large population of Texas that does not have health coverage. And finally, water. We're going to talk a little bit about water policy and natural resource policy. 59% of the water that comes from aquifers or underground pools. 60% of that is used in irrigation. Aquifer water is not renewable. It is, but it takes to renew it. It's not like it fills up. The lake does. It takes a long time for groundwater to seep into those aquifers and fill them up, drop by drop by drop. And so overuse of groundwater is a major environmental issue, but it's also ways that those who are dependent upon agriculture, especially in West Texas, have to get their water is through irrigation through these means. Basically, it comes down to what's called the law of the first person to catch water by pumping it out of the ground, and uses it owns. The problem is that pulling from a common pool. It's kind of hard to know where that's coming from. Yeah, so basically, it becomes a conflict between what's good for the masses, what's good for the public, which is to conserve and protect water, groundwater, versus individual property rights. So as an individual landowner, as an individual farmer or rancher, I need access to this, and therefore I need, my rights are important as well. Okay, I'm not gonna do any more with that. There's a lot more water than I wanted to do. Lots more water, more water. All right, so here we see some of the implications of not having enough water. We see the drought conditions that have been sweeping the state for, going on 7 or 8 years now. All right. All right, that's all I have for Chapter 12. So if you would like to ask questions about that in class, you are more than willing to do that, and I will be glad to listen. There you go. All right, remember that the review is available to you online and to be available for you to download. I'll have copies on this week in class, and we will go over some of that. All right, awesome. Thank you. Bye.